Good afternoon, and a sincere thank you for all of you being here today and all of you being in this fight with us. And we want you to know how much we appreciate everybody in the media. I know y'all are working in an immense number of hours, and I sincerely appreciate what you are doing, keeping Mississippians informed. And I want to thank the people of our great state for staying in this fight. Last night, we saw our largest death number yet. I want to repeat what I said yesterday because I think that it is critically important that this sinks in. One of the advantages from the perspective of having these daily press conferences is so many hundreds of thousands of Mississippians across the state are watching. It gives us the opportunity to speak directly to the people. And what I want you to hear me say, and I want you to understand that I am being as honest as I can possibly be with you. The threat is not gone. Even as we all want to move on, we have to stay vigilant. I know it is not easy. I know it is not fair. I also know it is not over. We have to keep fighting as individuals, and we have to keep fighting as a state. There is a reason that we have not thrown the state wide open. I hear the calls for that every single day. It's really where my instinct goes when I know and see the economic disaster that is in front of us. But I just simply cannot do that in good conscience. I want this to be over. I know that you want this to be over. But I can't just make it go away. Balance is the key. Every effort to reopen sectors of our economy has been done because we believe that it is safe to allow certain activities and to make them legal. But just because something is legal does not mean it is wise. Just because something is legal does not mean that it is smart for you and your family. You, as Mississippians, still have to make good decisions. There is no government replacement for your personal responsibility and wisdom. Please, take our warning seriously. Please, do not go back to normal. Please, do not give up. I have a real fear that I've been trying to communicate from the beginning. I hope our people are listening. Across the country, many of these social distancing measures have been a little bit like a really strict diet. People just can't sustain them for a long time. And when they start to reach a breaking point, they tend to go straight for a big old piece of chocolate cake. They give up on the mission rather than ease up on the measures. Whatever we do as a state has to be sustainable, or it will do more harm than good. That's why we are working to give people some semblance of normalcy. I cannot allow you to lose morale and give up, or we will see things get far worse no matter what any of my executive orders say. Please do not give up. We need you to stay smart. We need you to stay strong. You are needed in this fight. We know that not every portion of our state is the same. I've been talking with Dr. Dobbs about what we can do to stay flexible, to recognize that some counties may need more strict measures than others. We've been very good about getting resources and attention where they are needed the most and where they are needed quickly. We are discussing how to do the same with our orders and our measures. I would expect additional news on that soon. I want you to know, I'm tired of all this too. I'm ready to get back to life as normal. But neither you nor I can simply snap our fingers and make that so. What we can do is try to work together to help make things better, make them a little safer, make them a little more normal with kindness for your neighbors. And I know so many of you have been doing that. I see it. We all see it. Mississippians are helping Mississippians. It brings me joy in a dark time to hear your stories of compassion and resilience. I really believe that we are containing this as much as we possibly can. Do not mistake my hope and pride in the people of Mississippi for a belief that this cannot get worse. Do not confuse my belief that our strategy is strong with the notion that COVID-19 cannot kill one of your loved ones. There is hope. We are Mississippi. This is America. We have been through hard times and come through all of them stronger. We will get through this as well. I also want you to know that I trust you. I trust that you are doing the right thing in the face of tremendous pressure. That's why this has not been much worse at this point. I'm not lecturing or telling you what to do. I'm asking you, as a fellow Mississippian and as a fellow American, please do not give up and please do not give in. Take care of one another. Take care of your mom, your dad, your grandmom, your granddad. Take care of all of your loved ones. Today, in addition to Dr. Dobbs and Director Michelle, I've asked Drew Snyder of the Division of Medicaid to be here. He and his team have been doing excellent work, and we are getting emergency supplemental payments to hospitals to help them get through this time. We are being smart, and we are leveraging some of our resources to help support those very people on the front lines. Drew, would you please address that effort?
Thank you, Governor Reeves. Since the outbreak began, we at the Division of Medicaid have been exploring every available opportunity at our disposal to assist in Mississippi's response to COVID-19. The latest step has been to accelerate the delivery of supplemental payments to hospitals, which will make almost $170 million in support quickly available where the most intensive treatments are being performed. Specifically, these are two pools of supplemental payments: the Mississippi Hospital Access Program, or MHAP, and disproportionate share payments, or DISH. On May 1st, hospitals received $92 million in advanced MHAP payments, and they will receive $77 million in early DISH payments on May 14th. The accelerated payment avenue made sense for a few reasons. First, the state could respond relatively quickly. Accelerated payments didn't require statutory changes, nor was it the type of change in reimbursement methodology that required the division to go through a potentially time-consuming approval process at the federal level. Second, the impact on hospitals is immediate. A challenge hospital executives frequently mentioned to me that they were facing was low cash on hand, caused in part by historically low utilization. It wouldn't help hospitals that much if we increase their reimbursement rates when patients aren't seeking care right now for non-emergent procedures. But coupled with the federal funding hospitals have gotten directly from Washington, these advances should help sustain them in slow months until utilization recovers. And lastly, accelerating payments doesn't put a future strain on taxpayers. The Division of Medicaid has taken other steps as well, increasing access to telemedicine being one. In March, Governor Reeves announced that we'd received authority to relax federal requirements so that beneficiaries could receive telehealth services in their home through a personal cell phone, tablet, or other device. We also expanded the type of providers who could deliver telehealth, including rural health clinics and our federally qualified health centers. Furthermore, we received approval from CMS to expand the services available to our home and community-based waiver recipients, and those steps included increasing the availability of home-delivered meals and the availability of in-home providers. Overall, most of the emergency policies we've enacted are aimed at reducing barriers to necessary care, and we're committed to responding decisively in this emergency while still considering long-term financial consequences. We wouldn't be able to take these actions without federal flexibilities and the full support of Governor Reeves and his outstanding team. I'd like to also briefly express my appreciation to the Division of Medicaid's workforce. Medicaid's got a lot of moving parts, and the staff has worked hard to quickly enact a wide range of intertwining policies. And our eligibility workforce across the state has remained committed to ensuring our beneficiaries continue to have full access to the programs in our communities. So thank you, Governor.
Thank you, Drew, and thank you to your team for those efforts. I think what you are seeing every day as we bring additional leaders in our team to report to the people of our state is our state leaders in the executive branch of government are leaning into this virus. We're leaning into this response. We are doing everything in our power to ease the burden on Mississippians, and Drew and his team is simply another example, and I'm very proud of what they're doing. In addition to that, on the call yesterday with the Coronavirus Task Force, Vice President Pence, Seema Verma, who is the administrator of CMMS, was on the call, and she has worked diligently, as has so many people in the Trump administration, at trying their best to allow chief executives and governors to respond to what is clearly unprecedented times. With that, I'm going to turn it over to Dr. Dobbs and give us an update.
Thank you, Governor. So today we're reporting 330 new cases of COVID-19 and sadly 32 additional deaths. 18 of those deaths were recently recorded, with the remainder coming from death certificate or vital statistics data when we have done our searches of deaths recorded that way. If we look at the reasons for our ongoing cases, there's numerous possibilities, but certainly we are having ongoing community transmission across the state. So everyone needs to be careful. No place in the state is free from coronavirus, so we need to maintain all vigilance. We're also seeing outbreak settings, especially around nursing homes, and certain counties have a large proportion of our new cases. If we look at the top 12 counties, including Lauderdale, Hinds, Scott, Madison, Leake, Carroll, Jones, Neshoba, Forest, Holmes, and Copiah, those 12 counties account for about 50% of all new cases in the past 7 days. So we do have some areas that have enhanced activity where we will be focusing additional efforts trying to make sure that we can diminish transmission as much as possible. If we look at some of our other metrics of activity, our hospitalization utilization is one that we look at with a regular basis. We have 452 COVID patients currently hospitalized. That's a mild increase from yesterday, relatively stable over the past 5 days. We do have an increase in ICU COVID patients from 144 to 162, and 77 COVID patients on ventilators, which is pretty stable over the past several days. And then if we look at our surveillance data as far as COVID-like illness or influenza-like illness, those two different metrics, we can see some steady, slow, ongoing declines in COVID-like illness in clinic ER settings. Thank you, Governor.
Thank you, Dr. Dobbs. And at this time, I would turn it over to Director Michelle, who's going to give us an update from the Emergency Management Agency's perspective.
Thank you, Governor. Just real quick, give a PPE update on deliveries that have gone out. Today, of course, is our Tier 3 delivery push we made, pushed out to 82 counties, as well as the Mississippi Band of Choctaw Indians In addition to that, there were 2 Tier 1 deliveries that were made in 2 counties today. I just want to take this time to point out the incredible effort of the men and women of the National Guard that have been supporting these efforts, that have been on the road every day since the onset of this event. We could not have done that without their help and their support, and the thousands, literally thousands of miles that they have driven weekly to support this effort. I'd like to also thank the Animal Board of Health and the Mississippi Agricultural Commission. Today, they assisted in deliveries for PPE and masks that went out to poultry plants and catfish producers today to assist in getting the proper PPE out to the men and women that are working in those facilities. Also tomorrow they'll be resuming deliveries tomorrow that'll go out to the beef and poultry plants there. Just a real quick decoration update from the February 10 and 18th Pearl River flooding, as well as the April 12th Easter storm. Those 2 events, we have received federal decorations there. We are continuing to add counties to those 2 events. There are approximately 4 counties being worked to add back into the Pearl River flooding event back in February, and we've got approximately 25 counties that we're working to add to the decoration for the Easter tornadoes that struck on April the 12th. And as we discussed yesterday, April the 19th storm and April 22nd, 23rd, we are still conducting damage assessments to determine whether or not we'll be able to get decorations for either of those events. Weather update, we do have a minor round of weather that's coming into the state, to southeastern portion of the state, that should be moving out by about 7, 8 o'clock tonight. We're always very mindful to watch these systems this time of the year, as they could spurn storms. We don't anticipate this being a very risky event. And then Hurricane Preparedness Week, again, we talked about that yesterday. Starting Sunday, we're looking at Hurricane Preparedness Week. The talking point for today is your preparedness kit. I just want to point out to everyone that you should be using this time to inspect your preparedness kit. Items you should have in there: 3 to 5 days worth of food, any prescriptions for yourself and other loved ones in your household, special provisions for young children and pets. And then you want to also, this time of year, make sure that your vehicles are full of fuel as best you can be. In a pandemic event, you should also make sure that you have masks and hand sanitizer available to you should you have to go into a shelter. We will be talking with the county EMAs this weekend, talking specifically about hurricane preparedness. We'll be having cross-level discussions and just making sure that everybody's focused on those things that they need to be, so going into hurricane preparedness prepared. Governor, that's all I have today, sir.
Thank you, Director Michelle. I appreciate your leadership and your team as well. With that, I'll open the floor to questions. Courtney Ann.
With the numbers today, even taking the rolling averages from the last 3 and 4 days, the numbers are higher than what we had been seeing. Saw that Dr. Fauci yesterday at the national level making the comment, how many deaths and how much suffering are we willing to accept to get back to what you want to be some form of normality sooner rather than later? Can you talk about making these decisions amid a time that we are still seeing what seems like higher numbers, whether it be on the death numbers or on the case numbers, and if there is any kind of consideration that at some point there may have to be a pullback from that, no matter how difficult that might be logistically?
Well, there's no doubt that we find ourselves today in a period where, if you're looking at 5-day rolling figures, and you include the Friday and Saturday numbers, which were significantly lower than what we had been seeing, the 5-day average is still in a similar spot to where we were a week ago and maybe even 2 weeks ago. We were really going between 200 and 300 cases for a number of days. A lot of my colleagues around the country are not only look at the number of new cases on a day-to-day basis, but also the percentage, the new cases as a percentage of the total number of cases. And that's one of the things that has been declining in our state and really across the country. The reality is that the data is critically important, and what Dr. Dobbs just said, which is even more important, is there are a relatively small number of counties where we're seeing the largest number of new cases. That's because we have challenges there, we have issues there, and we've got to take more of a surgical approach at this time to make sure that if we need to push resources, if we need to push testing, if we need to push people in those communities, that's what we're going to do. you asked about my willingness to rescind some of the orders. I have been very, very serious about a willingness to make adjustments as the data suggests it. I do want to point out that if you look at the last 2 weeks, for instance, there are more than 100 new cases in Scott County, and there's 1 new case in Alcorn County. And so I do not believe that we should treat Scott County and Alcorn County necessarily the same. And so if and when Dr. Dobbs decides, and we've had these conversations, and I will tell you, none of these decisions are made after a 2-minute conversation. I mean, there is serious data discussed. There are comments. There are pluses and minuses. There are advantages and disadvantages in every conversation that we have. And if and when we decide that we need to put some additional measures in certain areas, and that may come, then I would certainly be willing to do so if it's in the public health interest of our state. I also understand that there are 200,000 Mississippians that are unemployed. Many of those Mississippians have never been on unemployment assistance in their life, and it is heartbreaking to me that they are going through that. And I will say I'm proud of the Mississippi Department of Employment Security. I am very pleased with their most recent announcement that they have partnered with the Scarlet Pearl Casino on the Gulf Coast, and the Scarlet Pearl has made the decision they're going to bring 30 of their current furloughed employees back in to help open a call center to help people get unemployment benefits. That's what's called Mississippians helping Mississippians. And, those are the kind of acts that just make me so proud to be a member of this state, Mississippians, because we are doing the right things. But to your point, if we do not want a return to where we were several weeks ago with more businesses closed, with more shelter in place, I have to ultimately make that decision. But the thing is, the people of Mississippi can make that decision first. If the people of our state will be smart, if they'll stay safe, if they'll wear masks in public, if they're going places, if they won't take the whole family to the grocery store, just 1 or 2 of them go, if at all possible. And by the way, look, I know that is not always possible. Some of us have a harder time getting babysitters, for instance. Some of us have to take our kids with us because of that. But if we can be smart, if we can stay home when we can, if we can make sure that we protect our elderly, those who are are in most danger from this particular virus, we can continue to move forward. But again, that's a decision that I can encourage, but that's a decision that you as Mississippians must make.
The Mississippi legislature is returning Thursday to establish a program and parameters and allocate funds to a state agency to spend on COVID-19 small business relief. Have you been part of that conversation with legislative leaders, or are you been shut out?
Well, what I would tell you is that I'm sure that they saw my press conference yesterday, and I know that I made a passionate plea. In terms of my views and my beliefs. I had a great conversation yesterday with Vice President Pence. He made it very clear that it is the Trump administration's position that the CARES Act is to be administered by the governors of each state, by the chief executives. In addition to that, we had conversations with the White House yesterday evening, and we do have information from the White House with the Department of Treasury, which is very clear that the United States Department of Treasury believes that it is the chief executives and the governors that are to administer these funds. And I've made my points very clear. If the Mississippi legislature believes that they need to override a veto, if that is what they believe they need to do, then they're just going to have to do it. I presume it is what it is. I am encouraged that rather than waiting 17 days, that they have now decided to come back after last Friday's and come on Thursday. That's positive. That shows a good faith effort. And so I'm hopeful that they will get here and that they will do it quick. I have concerns. I've been involved in the legislative process for many years. Most of the people that are watching this today may not know I was involved in it for 8 years, and I was pretty active and pretty good at it. But that is not something that, in my opinion, is conducive to spending money quickly, getting it into the hands. And look, the reality is that after we tried to encourage them of the dangers of what they may be getting into, when they initially made their decision, I will admit that I was angry. I was mad. But now I'm way beyond that. I've got too much other work to do. I got too much stuff that I have to get done. We had the largest number of cases 2 of the last 5 days. We've had the largest number of deaths yesterday. I know that I have, there's no saying in politics that friends may come and friends may go, but enemies accumulate. I know that I have some enemies from events that occurred weeks, months, or years ago. I get that. I understand that. And the reality is, many of my enemies in this process would love for me to spend every waking hour right now focused on some legislative battle. But what I will tell you is the people of Mississippi don't care. They don't care about all that internal politics, all that he said, she said nonsense. What they care about is that they have a leader that will focus on doing what's right. And my commitment to the people of this state has been to do what's right every step of the way. I have alerted the legislature to what I believe can have grave consequences for the people of our state in the short run. But I will tell you, the Office of the Inspector General of the U.S. Department of Treasury is coming. They make that very clear every time we talk to them. They're coming. So on the back end, they're going to come and they're going to look. And they're going to decide, was the money spent properly or not? And so we've got real issues in the short run, and then we've got issues in the long run. But if the legislature wants to override a veto, and they feel this strongly, and they want to take the risk, they know the risk, that's their prerogative.
So you don't have a seat at the table currently?
I'm not going to talk about individual conversations.
I'm not talking about individual conversations. I'm talking about whether or not you have a say in where the money goes.
I think that as we move along in the process, we will see exactly what decisions the legislature makes. They have passed a bill. It has not been properly delivered to the governor's office. Therefore, I can't make a determination as to exactly what I'm going to do with that bill. I'm sure by Thursday, or if they come in Thursday, they'll give the senators the opportunity to properly look at the motion to reconsider. That's the reason it was so hurriedly and done wrong on Friday. And when they were talking about coming back 17 days later, they had forgotten that little constitutional provision that gives every senator the right to reconsider their vote. But again, all that's nonsense. The people of Mississippi don't care about any of that. All they want is to get the money in the hands of the people who need it the most. I'm committed to that, and we'll continue down that path. Renee.
Dave Elliott with WOX.
Great.
Dave?
Thanks, Renee. Governor, the legislature did give you $100 million to use at your discretion to keep state agencies running and help them deal with COVID-related issues. You have another $34 million or so to help schools. Federal guidelines are clear on the federal funds. They must be spent on coronavirus-driven programs. We've talked about help for businesses and cities. They need it. But that appears to be non-compliant with the intent of the CARES Act money. So how do you plan to make that happen or work and still follow the rules?
Well, what I would tell you, Dave, is a couple of things. Most important thing is the rules are changing. The rules are changing every single day. The Department of Treasury sends out guidance. They sent out their initial guidance, approximately 2 weeks ago. On Sunday of this week, which I guess was 2 days ago, they sent out additional guidance. In the additional guidance, what they said, and again, I'm not sure where you got your information from regarding what was allowable under the Treasury guidance, but under the new guidance, it is very clear that the state of Mississippi can distribute funds to local governments to pay for police and fire expenses that were a result of COVID-19. Now, it's also very clear in the guidance that they can do that at the discretion of the chief executive of the state. But because you're right, the $100 million that was allocated to the governor, it is very clear in the bill that they passed that that $100 million can only be spent at state agencies. I'm not worried about state agencies. State agencies are going to be fine. They're going to be taken care of. The people who need money right now are our cities because they have significant expenses. I'll give you an example. How much money do you think my buddy, the sheriff of Harrison County, has spent on officers doing overtime to make sure that they're monitoring the beaches in Harrison County? Because I've talked to him. I know that he's done a great job making sure that the beaches are monitored and doing everything he can to keep social distancing guidelines in place. But I also know that that comes with a cost. And so the Treasury, for instance, at the discretion of the governor, gives the states the ability to transfer money to him. But under the bill that was passed, if I adhere to it, then I can't do that because I'm limited to state agencies. You see, Dave, you've hit on a very important point, the point that I've been trying to make from the get-go. These guidelines are going to consistently change between now and December 30th. Every time we ask Secretary Mnuchin, when I say we as governors on our 3 or 4 calls a week, every time we ask him to consider something, he does. Sometimes the Trump administration can do it for us. Sometimes it's not within the law and they can't. But the point of this whole conversation is the difference between a chief executive and his or her ability to be nimble and that of a legislative body, which at some point is going to come in or come out. They're going to eventually adjourn sine die after they run out of a number of days. It's that lack of nimbleness that I think is a bad idea. Now, I've alerted you to it. I've alerted everybody in this press conference to it. I've alerted everybody in Mississippi to it, and I have alerted every single legislator. We have put them on notice of the challenges. If they choose to move forward and override the veto at whatever time's available, that's a decision that will be on them. Renee?
Nick Juden from Jackson Free Press has a question. Nick?
Hi, I'm having restaurant employees reaching out saying that they're being called back into work, but they are immunocompromised or they're living or taking care of someone who is. Do they still qualify for unemployment if they decline to return for work on Thursday?
I'm sorry, Nick, I missed that first part of your question. You're hearing from who?
Hi, sorry. I'm hearing from restaurant employees saying they're being called back into work on Thursday.
I believe that what I would suggest to individuals is if your employer is trying to put you back to work, I think it is a very wise thing for you to go back to work. If you have specific circumstances that make that unsafe, reach out to your employer. I feel certain that Mississippians are going to work with their employees if there is a legitimate issue with one's ability to work. I'm confident in the hearts of Mississippians. Yes, sir.
This question is for Dr. Dobbs. What are the updated numbers when it comes to African American cases with COVID-19 and deaths, and what is the state doing to slow down those numbers of cases?
Yeah, no, thank you. Of our total cases, 8,207. The African American case number is 3,731. So not quite 50%, but certainly almost, and certainly disproportionate to the number of cases. If we look at our deaths, we have 342 deaths, and of those, it's 161. So, again, disproportionately large number of deaths. We recognize that African Americans are the most affected population in Mississippi with coronavirus. We have engaged some fantastic partners. We have a team and a task force devoted solely to this function. It includes media, social media. I don't know if you've seen some of the PSAs, or we've got a new video spot out with Benny Thompson and Senator Turner Ford and some other folks. And so we really look forward to getting that out more. Communications is key, working with black churches, Head Start centers, HBCUs, everything we can think of, but also working with partners who work in hard-to-reach communities, whether it's, we've got an innovative approach. We're trying to use community-based organizations to do testing in the community, and the community health centers have, especially in some areas, Mound Bayou, I talked to my friends in Laurel recently, have been really innovative getting in the community, doing testing, making sure that people have access to care. So there's a lot going on in Mississippi. Certainly, we've talked about this before, where, that there's things we can do now and things that are going to be long-term. And so, we're committed to the now, but also we'll be committed to the long-term things that address the social determinants of health.
Yeah, and I would point out the CARES Act provided significant resources to the FQHCs, which have really done a fantastic job in our state of stepping up, particularly in those rural communities. And I commend the Trump administration for the CARES Act, but I also commend them for making those funds available. Not only did governors get significant money to help their states, not only did hospitals get significant money, in addition to that, the FQHCs got significant money, which certainly helps in our minority communities across the state. Renee?
Emily from AP has a question.
Great.
Emily?
Hi, Governor. I wanted to ask you again about the issue of COVID testing in the prisons, and perhaps also circle Dr. Dobbs in on this question. When will there be an increase in the number of tests, which has been a very low number so far?
I have an email with respect to that. I have not opened it yet. Dr. Dobbs, do you have any comment there?
I don't have any updated numbers other than, we're working closely with Department of Corrections, making sure they have the best and updated guidance. I know that we've had some arrangements to do site visits to make sure that we can support the efforts. But, it's an ongoing collaboration, and certainly appreciate their willingness to work with us.
Yeah, Emily, what I would tell you is I did get a report, I believe it was late yesterday. In that report, we have tested, according to the Mississippi Department of Corrections, 33 total inmates. There are only 4 positive tests. We have had 25 negative tests, and there are currently 4 tests that are still pending. Of total staff, we have tested 41, of which there are 7 positive tests, 30 negative tests, and 4 pending for staff at the Department of Corrections. So there's a total of just under 100 total tests in the system. As you'll recall, we made the decision very early on that we would not allow for inmate transfers, that we would not allow for visitation. By the way, that's a very difficult thing on inmates. It is a very, very difficult thing. They're used to being able to have visitations. And so, we talk a lot about things here at this table. And one of the things I don't think we've talked enough about over the last several weeks is the mental health issues that so many Mississippians are dealing with. It's something that we've got to put a renewed focus on, I believe. It's something that we're certainly going to spend more and more time on. But those mental health issues are certainly out in our communities, but they're also in our corrections system, and we're trying to do everything we can to give them more and more opportunities to get outside, et cetera. But our first goal is safety of the inmates, and given the fact that we've only had 4 positive tests of inmates right now, I think if you look in a lot of other states, that's a very, very, very low number. Yes, sir.
Governor, you mentioned a plan in a prior news conference for more money going towards iPads for students. Is there a plan that you're thinking of to continue or further telehealth even as coronavirus numbers decrease?
Yeah, so some of the things that we have said that if the legislature does not take the CARES Act money, that we would spend money on, providing additional technology for school districts. We would provide to ensure that they could do distance learning. We think that clearly complies with the CARES Act and the Department of Treasury's guidance. We would make checks available immediately for every barber in the state. We would make checks available immediately for every salon worker in the state. We would make checks available immediately for every barber shop owner, because those folks got to pay their rent. And they're not working because they don't want to work. They're not working because their government shut them down. We would provide payments immediately for every salon that is shut down. We would, in addition to that, would make payments to our teachers. You know, many of our teachers, and we were thinking at least $1,500 payments to every teacher across the state. And the reason we would do that is because many of them had to pay money out of their own pocket to pay for the materials and the supplies. Maybe they had to upgrade their online capability so that they could teach students through distance learning. We would provide additional monies for small businesses, you know, particularly those that did not participate in the PPP program in the CARES Act. We would also make sure that we were providing additional resources for our gym owners. Again, the gyms are struggling around the state. We would also provide monies for our restaurant owners to buy the mask and the PPP that is required of them now that they are reopening. This is what we want to do with the money. This is what we would be doing with the money right now had we not hit this hiccup. We think it's important that we get this money to people now. These folks a month from now, 2 months from now, 3 months from now, very well may be way too late. That's why I am encouraged that the legislature is coming in on Thursday. I'm hopeful they're coming in to at least come up with some good ideas. I hope they'll take our ideas and utilize them if, in fact, they were to get me a bill that became vetoed, and then if they were to decide that the warnings that we have given them were not enough and that they wanted to override the veto. And I'm hopeful that that won't happen, but if it does, it will. Yes, sir.
And just a follow-up, you mentioned barbershops and salons. I've talked to some people who say that they feel like, honestly, with more restaurants opening up, they have a greater risk of catching the virus through cross-contamination through restaurants than, going to a barbershop or a nail salon. What would be your response to that?
Well, here's what my response would be. I feel for our barbershop owners. I feel for the barbers. I feel for those who work at salon shops. All told, by the way, there's almost 45,000 of those individuals that are regulated by either the Cosmetology Board or the Barber Board. By the way, when I tell you that we have a plan to immediately get checks in the hands of these individuals, it's because we've been doing the research for weeks now. We have been thinking that we were going to operate under the CARES Act as it was written and the guidance as it was provided by the United States Department of Treasury. And so we want to get that money in their hands as quickly as possible, and that's what we had planned to do. That's the reason I know these numbers off the top of my head, because I know that with 45,000 of them existing, $1,000 check in their pockets would mean $45 million out of the CARES Act. But that would be a great way in which to expend those monies because their government has shut them down. And so I feel for those individuals. But what I want you to know is that while I appreciate their beliefs as it relates to how they compared to the restaurant owners, the experts, the scientists tell me that the science just doesn't bear that out. I had a conversation with Dr. Burks. She was on the call yesterday that I was on. If you'll look at the Trump administration's guidelines, barbershops and salons are not open in either phase 1 or phase 2. And remember, in those guidelines, phase 1 doesn't even begin until 14 consecutive days of declines. Now, we have looked at our unique situation, and determined that those guidelines and that 14-day requirement, and we confirmed this with Dr. Burks on a phone call a couple of weeks ago, doesn't really work in states like Mississippi, because our social distancing guidelines worked well enough that while we have had a relative plateau for the last 35 or 40 days, we never had the spike that New York had and New Jersey had and Louisiana had. And so therefore, again, my heart breaks for those barbershops and salon workers. It absolutely breaks. And nobody wants to reopen them more than I do. Unfortunately, the science just doesn't bear that out at this time.
Anita Lee with Sun Herald has a question. Anita?
Thank you. Dr. Dobbs, I apologize. You broke up on my computer at the beginning of the news conference when you're talking about the 18 cases. And I just wanted to clarify how many of those 18 cases are marked suspected COVID cases and death certificates, and where are the other ones from? And is it correct to say we have 14 new cases yesterday? And I do have a follow-up question.
Yeah, I'm sorry. And it is the same, but the reverse. There were 14 cases that were identified on death certificate review, and then additional 18 cases that came in through the lab confirmed process. So there's a bit of a process whenever we get a death certificate that has coronavirus as a diagnosis. We do have to do some research, and that does cause a little bit of a delay. I think that's one of the reasons why some of the coroners think that their cases aren't getting reported, but there's a lengthy research process that has to be done, pulling medical records, et cetera, trying to see if there were positive or negative cases, because actually we get a lot of information in those, and so there'll be some more over the next few days as we do additional look backs and trying to figure out what was going on.
Well, I was wondering, the follow-up was how many of those were just suspected and how many coroners had confirmed, because I'm wondering if coroners are ever going to be getting test kits. I understand there's a process for that through MEMA, but one of the coroners down here has followed that process and still doesn't have kits.
Yeah, and that's something we've been looking into. So for a while they had access, or at least some of them had access, and so they've been testing, but it hasn't been universal. The way the coroner system is, there's a lot of autonomy. But we've identified resources and can get them there. There should be availability. As far as we count them as a case if the coroner or the physician calls it a case, unless we have a negative result in the recent past, right? So basically it confirms that it wasn't coronavirus. And there have been a few of those actually that we do have, but we will count them as a case if the coroner thinks that's what it is, even without a positive test.
So just to repeat that, because Dr. Dobbs and I had this very same conversation yesterday as we were talking through the data. There are corona deaths that are listed as deaths in Mississippi that do not have confirmed positive tests for having COVID-19. If the coroner or the physician in charge says that it's a coronavirus death, it is recorded as such, unless there is a negative test which refutes it, which certainly is a model that makes sense. Yes, Renee?
Dave from WLX has another question.
Great.
Dave?
Yeah, Governor, casinos have been shooting for a Memorial Day weekend opening, and you appear to have at least recognize that as a possibility. Well, that's in just 18 days. They've been making plans, they've been preparing, but if you've declined to open things like hair salons, bars, and gyms, considering the size and scope of casinos, if the numbers continue as they are, do you think that Memorial Day opening is possible, or do you expect to perhaps delay it?
Well, what I would say is it is certainly possible. It is something that I'm interested in looking into and doing. In this particular scenario, I will tell you that 2 days, it seems like an eternity and a lifetime for ever-changing environment. So 18 days is a lot of time. But we have been having conversations with them. My staff has, my team has. And what I would tell you about casinos in terms of what I am learning about the transmission of the virus, the bad things about a casino with respect to transmission is it's mostly all indoors. That's not a good thing. The passing of cards could very well not be a good thing. The fact that you have large groups of people coming from a long way away into one spot is not particularly a good thing. While at the same time, the good thing that plays in their favor is the fact that they tend to have very, very large floors, that they could implement social distancing guidelines and requirements. They could very easily, for instance, not open their card games or table games. They could very easily, for instance, only open every other slot machine. And so there's a lot of different guidelines that the regulators, the industry, my team, the health team are all looking at. If and when we reopen casinos, and we will, we're going to do it in a safe way. Just exactly the way we've been methodical. We were very slow and criticized gravely for it in shutting things down. And we've been methodical in being smart about reopening, even when it's politically difficult to do so. My commitment in this entire process, I committed to myself on day one. We're going to make a decision based upon what we believe is best for Mississippi residents every single time. And so I believe that we have a pathway to getting to reopening casinos in a relatively short fashion. I've talked to some of them who have said they can get open in 2 days, and I've talked to some of them who said it would take 6 or 7 days, and some maybe even longer than that. But we will get them reopened at the appropriate time when it is safe, and we will do so at the absolute earliest time when that is the case. Renee?
Nick from Jackson Free Press has another question. Nick?
Hi, yeah, I have to follow up on the question on unemployment for restaurant workers. I understand you're suggesting you communicate with your boss, but since the beginning of this crisis, I've heard from many workers whose health concerns are being ignored and minimized by their employer. Can you answer directly? If you are called back into work, do personal health concerns for yourself or your family legitimize an unemployment claim or not? And then I'm going to have a really quick follow-up for Dr. Dobbs after this. Thank you.
Sure. That's a question for employment security. I will find out the answer and get it back to you. What I will tell you is, if it is at all possible, if you are called back into work, I sincerely encourage you to get back to work, because let's not forget that the pandemic unemployment assistance, for instance, will be over at the end of July. And so we're trying to get as many people as we possibly can back to work as quickly as we can. If you fit into that vulnerable category, however, there is a shelter in place for those that are over the age of 65 and at those that have pre-existing conditions. And so, again, I'm calling on all Mississippi business owners to be smart, to work with your employees. If there is a legitimate issue, the guidelines certainly require that there is testing in place, for instance, for a restaurant worker, that there is, that they have to ask questions if they are, how they are feeling, potentially taking their thermometers, et cetera. And we don't need sick people in restaurants. We know that for sure. You have a follow-up for Dr. Dobbs?
Right. So, Dr. Dobbs, moving forward, can MSVH separately report new deaths and reports of previous investigations so that we can get a better picture of what is happening when? And do we have any more information on the transmission in or around meatpacking facilities in some of the current hotspots?
So the second question is easier than the first, is that we're ramping up our investigations, although, we're seeing a large number of cases in communities around or in the local areas of these plants. We still haven't defined. Most of the cases that we're finding in these areas do not work for poultry processors, right? So it doesn't mean that there could not be some, but the majority of the cases we're finding do not work there. So there's something that is happening in the communities, whether or not there's a component of it coming from these places, these industries is plausible, but there's clearly a lot more going on that we need to dig in on to try to make sure that those communities have what they need. The first question is, I could report something about the deaths daily. Do you want the number of deaths that are reported each day? I misunderstood that.
Right. What I'm asking is, so for example, today we saw 32 new reports of deaths, which was, shocking in the sense that it was twice more than any other single day's death toll. Could we get each day that there are sort of backdated reports from the death certificate investigation? Could those be separated out in their own category so that we know what deaths come from the day before and what deaths come from prior investigations?
And I'm sorry, it does put that out in the reports I get. So I thought you had it too. I'll go back. We can certainly do that. That's an important distinction. Thank you. I agree.
On Friday they had a note that said that, and I don't think that was there today, but yeah, that'd be great.
We'll try to do that going forward. Thank you, Nick.
Emily with AP has another question. Emily?
Governor, I wanted to ask you, Governor, about the process of hiring a consultant to help manage the federal relief money. The deadline for application on that is, if not today, then in the next day or so. What's the status of going forward with that, given the bill that you say you still haven't received yet? Are you going forward with hiring a consultant?
My understanding, Emily, is that the responses were due either yesterday or today. My understanding is that the individual group that includes those at the Department of Finance and Administration that are focused on things like procurement, that this is what they do all day, every day, is doing an evaluation, and they're going to make a recommendation to my office. Regardless of who is going to decide who spends the money, someone has to ensure that we are spending the money in a way that is in compliance with Treasury guidelines. Someone has to actually administer the funds. I kept hearing from legislators last week, and they just kept saying, "Hey, that's no problem. We don't need to pay any. We don't need to have a third-party administrator of these funds because we're just going to let the auditor do it." I kept hearing that over and over from legislators, that was just evidently what somebody had told them. And I'm afraid that that's a simple misunderstanding of the role of the state auditor in the state of Mississippi. I'm under the impression that the state auditor said today on the radio that if he were the one to do that, that would preclude him from actually auditing the funds on the back end because of his requirement to have independence. And so I know that there was a really quick push to get this done, and I know that leadership told all the members, the House and the Senate, that, hey, we can get this done for a very little amount of money and we can let the auditor do it. And look, I can't tell you how many times in the last 16 years that agencies that I have been in charge of or agencies that have worked for me have asked for the auditor, hey, can I do this with this federal money on the front end? And the auditor really can't answer that question, because if the auditor is giving advice on the front end on how to spend monies, it precludes his ability to claim. And by the way, these are standardized accounting rules. I mean, this isn't Tate's rule. This isn't the state of Mississippi's rule. These are the rules that have to be followed by the accounting guidelines. And so we believe that it's critically important. Again, my concerns have been relayed to every single individual that is engaged and involved in this process. I have raised the red flag. I have urged them to proceed in such a way that protects Mississippi. And one way that we can protect Mississippi from getting significant amount of dollars in clawbacks. And by the way, I'm not talking about a few $100,000. I'm talking about hundreds of millions of dollars. You know, if Drew gets a little bit of federal money in his agency, probably $5 or $6 billion. He would know the exact number, but let's call it $5 or $6 billion. The CMS, or at least HHS, one or the other, he would know. But I'm not gonna make him opine on this. But whichever agency, and it may be both of them, they have an Office of Inspector General as well. And if they give him guidelines on what he can spend the money on, and he spends it on something outside of those guidelines, whether told to do so by the legislature or not, I promise you, the OIG's coming back to get that money. That's just the way it works. That's the way federal money always works. It works that way in Medicaid, and it's going to work that way in the CARES Act. That's just a fact. That is an undeniable fact. And it doesn't matter what we argue, and they don't care what the politics are. And I will tell you, if the Trump administration gets reelected, and I am going to work as hard as I can if we ever get beyond this virus to make sure that happens, the Trump administration's OIG is going to make sure those monies are spent appropriately. And if President Trump doesn't get reelected, and God, I hope that's not the case, but if he doesn't, then there's going to be an OIG that works for a Democrat in Washington that's going to have their eyes set on a red state in Mississippi. I'm just telling you. And again, I'm not mad at anybody about it. I'm not trying to threaten anybody. I'm just simply telling you, this is what's going to happen. And I'm convinced of it. I believe it. I actually have written on paper numerous times where it is the belief of the Department of Treasury that the chief executives are going to administer these funds. It is my opinion that if the legislature goes in a different route, it is my opinion that not just $1 or $100 or $100 million are going to be at risk. My view is that the entire $1.25 billion may be at risk. And I'm just curious if that is a risk worth taking. And obviously I have an opinion on that. Maybe others have different opinions, but Cornelian?
When we talk about those top 12 counties and half the cases over the last several days coming from those counties, you talk about how there could still be county-specific things coming down the pipeline. Could you speak to a little bit more what that might look like? Would it look like a combination of more resources and contact tracing and those sort of things and more restrictions, or a combination thereof?
Well, for certain enhanced investigation resources, testing, we've started delivering some community masks so that people can have access to them if that's a limitation. So there's a resource and there's a manpower investment that's part of it, but there also needs to be consideration of slowing down the process of opening, or maybe some different things that might be useful in certain communities. There's no decided pathway, or certainly we've been talking about it a lot, trying to find the best balance, and also have been talking with local community leaders, trying to see what their perspectives are. And in some of the communities, they have asked for certain things to be instituted in their communities because they think these things will help them. And so it's really good to have buy-in from local leaders to know what they think will work, because they're the ones who really know their communities better than anybody.
Yes, sir.
Governor, Dr. Dobbs mentioned community transmission. Was this something that was possibly a problem before you extended the amount of people that could be outside? Or if so, was this something that you all had a conversation about beforehand?
Yeah, well, the first thing I would tell you is yesterday when I increased the number of people that could be in groups outside, I announced that it wouldn't take effect until 8 o'clock a.m. on Thursday. And so the community transmission has been an issue from the very beginning, and it's something that we've tried really hard to address. One of the things that we know is if you have person-to-person transmission, and I'm one person and I give it to one other person that I see, and that's the only transmission that occurs, while that could be very dangerous for me and for you, the two of us that have it, from a community standpoint, it doesn't take significant resources. However, if you've got a preacher who has it and they have a large wedding and 40 or 50 people in that wedding get it, and then they go out in the communities, that's when you can start getting an overwhelmed hospital system and an overwhelmed health care system. And so one of the things that we're trying to do, and that Dr. Dobbs has done excellent leading our state in since the beginning, is contact tracing. He has a staff which is larger today than it was when we started this, and that's the reason the federal government stepped up to help us financially. But they're doing contact tracing, they're making those calls, they're finding out who has it, and then trying to limit and even quarantine when necessary, not only those individuals that have it, but also those who have been in close contact to them. But I'll tell you that the community transmission piece is an interesting one. I've listened a lot to the experts like Dr. Dobbs and Dr. Birx and Dr. Fauci throughout the last 6 weeks. I've learned more about transmission than I ever thought I would. I still don't know nearly as much as most of these folks, but it seems pretty clear to me that those who are living in close quarters, communal housing, is a real issue in terms of transmission. And so I think, and I'll tell you, when you look at shelter-in-place orders, particularly in really densely populated areas, I think there's an argument to be made that shelter-in-place orders may actually exacerbate things rather than actually slow them, because you're taking a lot of people that probably already have the virus and putting them in very, very close quarters. We have some of that in Mississippi. It's not anything like New York or even New Orleans, but I think that's probably something that we're going to monitor and look at. Renee?
Nick from Jackson Free Press has another question. Nick?
Very quickly for Dr. Dobbs. We've talked last week about deaths by race and gender combined. We have that information for the cases, but we don't have that information for the deaths. Could we have that information posted with the daily updates from now on?
I thought we had that in there. Dr. Byers, if you hear me, let's go ahead and put that down there. I'm sorry, because I saw the slides and I don't think they made it in there. So yes, that's something that's easy to do. Sorry for the delay.
Okay, one more question. I would just like to, again, thank every single individual for being here today. I particularly want to thank these three individuals for the work that they're doing. And I just want to conclude by reading a quote to you in information that I received from the White House late yesterday evening. This is from the head of the Intergovernmental Affairs at the White House. It says, and I quote, "I have consulted with the U.S. Department of Treasury, and based on their interpretation, the Coronavirus Aid, Relief, and Economic Security Acts, also known as CARES Act, Coronavirus Relief Fund for state governments, is intended to be administered by the governor of each state." Thank you all, and God bless.